sleep habits, eating habits, water, mental health, like all these other kind of broader things that influence health and pain and injury risk, all those kind of stuff. Is there things that you do with netball, Ali, that help, whether or not it's evidence-based yet or is yet to be proven, or and injury as well, your perspectives?
Well, there is some evidence to say that nutrition and sleep are associated with a greater risk of injury if you aren't getting enough of either of those. So not specific to ACL. So we do have evidence to support that. Interestingly, in the same surveillance data of our 19s and 17s, more than 50% of that cohort were getting not enough sleep and at risk of low energy availability.
Yeah.
Side note, those 50 and 57% didn't have a greater injury incidence in that tournament. So there's still a little bit to be learnt about that. But I think we do have a role in educating athletes around the potential risk of getting enough sleep, eating enough or getting enough energy availability, and sadly in the female space looking out for low energy availability and relative energy deficiency in sport, which is a significant problem at many, I think, from community to elite level, realistically, in the sports that I've worked with. I think that I think the well-being space is really important in both female and male athletes, and I really have enjoyed being involved in elite sport over the last 20 years. The shift that I think is happening around empowerment of athletes and the athlete voice, and the treating them as whole humans that happen to do the sport that they do, rather than as a vehicle just to win the premiership or. How that directly relates to injury risk, I think that's pretty hard to quantify. But it's my gut feeling that the better we can do in that space, the better off we will be.
I agree. And Andrea, anything?
No, only just to say that all of those things help the person just live a healthier life. Like even if we think about strength, I mean, sure, we may not know, but it's strength training actually helps reduce osteoporosis as well, and so good joint health. So it's about the whole person as a package.
And actually stepping back, we've talked about performance and elite level as if every single athlete that takes a netball court in my sport wants to be a diamond, but the reality is a lot of them are doing it because it's good fun and they're enjoying time with their mates and they are being healthy, and the side benefits from a public health perspective are massive. So that's also why we should be including them. And Andrea touched early on, I think in netball in particular, once an ACL injury occurs, I don't know the stats, but I think that there's a large dropout, especially in women and especially in women who are maybe older and have family responsibilities, etc. That there's just too much for them to take on. And that's a loss for our sport and a loss for their health and well-being.
Do we have to be careful because I think we touched on it before, is the language we use when an ACL injury occurs? Do you think sometimes there's some fear, within a club? Like if you're a young girl that plays netball, plays AFL, plays soccer, and all of a sudden now your teammate goes down with an ACL, do we have to be careful with some of the language we use as clinicians and health professionals? Because I could imagine there's an injury that occurs to one of your teammates is now going to all of a sudden now sit in the back of your mind that, oh, geez, this might happen to me.
I mean, I think we look at the literature from other conditions. So in osteoarthritis, in low back pain, how powerful how we say and what we say to our patients or to the people we work with, how that can influence things. And I think even just before we're off camera talking about ACL injuries and surgery or non-surgery, and there's so much messaging around that, and we need to start small with that as well. So going back to your original question around should we be careful with what we say, absolutely. Same as should we send someone for a scan or not? Do we want to just have a go first and do a good prehab and then see if that doesn't work or you're not being able to live the life that you want to live, then look at other things. I think people probably get worried about time. An ACL injury is this amount of time out of sport, and then if I do a prehab and it delays, if I'm going to have surgery, that comes into it as well. I mean, there's lots of different things, but having a conversation with the person and getting to know them, I think is a very important first step. And sometimes people just don't know where to go to have that conversation as well, which again, physio has a big role there.
And stepping back to the wider team component. So if you're a teammate of someone who's had an ACL injury, that can be a real teaching moment to say, we are putting these programs in place, or maybe we're not, and we can. And that we do have, I think it's a real myth that that in netball, for example, that it's a byproduct of playing netball, and netball is bad for knees, and ACLs are going to happen. And I think messaging around, we have a role, we have good evidence to say that there are injury prevention or risk reduction programs, and they're relatively easy to do. So either reinforce that we're doing them, and this is unfortunate, but maybe it's the one that we, or maybe we haven't been paying enough attention to them, and let's all get on board and support our teammate that's going through their rehab, but also do the injury reduction exercises ourselves.
Absolutely. There's it was funny, like I'm just reflecting on a girl that I saw recently. She's just had an ACL injury, and this is probably going back to that more broader, appreciation of now we're talking about ACL injury management as opposed to ACL injury prevention. But I think that whole broader context of not just looking after her post-operative knee, she's like, what other things can I do to just improve me in general? Now, I think that was really nice, to sort of really refreshing to hear from such a young athlete to say, what are the 1%ers that I can do? And I think that same thing with injury prevention. Like, we know that an 11 plus, a netball knee, an AFL prep to play, like they probably look after 95% of the injury reduction risk. If we've got that being done on a regular, consistent basis, we're doing a good job. The fact that we're probably it's not widely accepted is probably half the battle. So if we can improve that, adherence and compliance rate, then that'll be making massive steps. But then the sleep quality, the nutrition, mindfulness, just the stress levels, all those kind of things, no doubt have small little roles to play. And I think if we can look after those little 1% as well, and really champion those parts of our young athletes' lives and look at that stuff, I think that'll be a nice thing for us to do as well.